Hi, and welcome to this short talk from Teach Me Surgery on how to refer a patient. Referring a patient can often be a cause of anxiety and a challenge for junior team members. This video aims to give medical students and junior doctors an easy to remember way of referring patients in the future. It's important when referring patients to be clear and concise about the information you're giving, to provide a focused description of the problems that's tailored to the team you're referring to. It's important to appear professional and keep the interests of the other team. There are often pitfalls that happen caused by referring, and this video aims to address some of those. And ultimately, it's to get the best outcome for your team and the patients. So here are some examples of what often goes wrong. The reason for the referral can be unclear. This can either be for the team that's being referred to or the person who's doing the referral. It's important that when you're doing a referral, you understand exactly why you're referring to the patient and what the need is. You need to ensure that the information you're giving is exactly what the other team need to know and that you avoid waffling. Sometimes the wrong information can be provided, and this can be a cause for confusion, particularly when urgent referrals are needed. There sometimes is a lack of understanding of the patient's current needs. Do they need escalation urgently to an ITU, or could they be managed on a ward? You can often be asked questions by the team that you don't know the answer to. This can be tricky and often a source of conflict. So you have to be prepared that you can't answer all questions, but it's also important not to lie or to falsify any information when referring. And you can sometimes get ambiguous answers from the other team. It's unclear whether they will take over care or whether they'll come and review a patient. So to avoid some of these common pitfalls, you can use the mnemonic SBAR to refer patients to other teams. SBAR stands for Situation, Background, Assessment and Recommendation. In the situation segment, you want to give one line of the presenting complaint. So what's the current issue? In background, you want 2 to 3 lines relating the history of the presenting complaint, past medical history and any social history relevant to the current episode. In assessment, you want a few lines about what you found on examination and investigations, including any current observations. And finally, R for recommendation. What would you like the other team or person to do? Would you like a review? Would you like them to take over the care? Would you like some advice? So when referring to certain teams, you may need to give specific information. These next slides will suggest what you should do when referring to the surgeons and to ITU. So when referring to surgeons, it's important to first of all know that you have the right team. Does this patient require the vascular team or the general surgical team? What's the urgency of the surgical input? Does this patient have an acute abdomen? Do they need an operation right now? Or is this a routine review? It's important to clarify any previous surgeries. Has this patient already been seen during their current stay? Have they been seen in the past for this current issue? Do they have a named consultant? Is it possible to contact that named consultant or their secretary for advice? Check any previous images that may have been done and be prepared to request any suitable investigations. These may include abdominal x-rays, CT scans. It's important to highlight any ongoing treatments and current medical issues that may relate to the surgical patient. If they are for surgery, it's important to note when they last ate, if they're on any anticoagulants and whether or not these have been stopped, and what their latest bloods are. It's important to also do a group and say for any patient undergoing surgery. This is a surgical case example, and we'll use the SBAR for this patient to show how this patient could be referred to the surgeons. So you're on your ward round when you see a 69-year-old male patient who develops central abdominal pain that radiates to the back. He's become more unwell, and your consultant is concerned that he may have ruptured a AAA. This requires an urgent surgical review. Using SBAR, the situation being that you have a 69-year-old male who's currently an inpatient treated for lower limb cellulitis on IV antibiotics, who's got central abdominal pain radiating to the back. The background is this patient has become more unwell, more unstable, and you think they may have had a ruptured AAA. They have type 2 diabetes, CVA and COPD as past medical history, and they're previously self-caring and independent with ADLs. The A in assessment suggests that there is a pulsatile mass on the abdominal examination and nothing else remarkable found. Observations show hypotension, tachycardia, raised respiratory rate and an apyrexic patient. You've also done some bloods. This is important to tell the surgeons under the assessment point. So the bloods show anemia with a normal white cell count, normal usinase and normal LFTs. A VBG shows the raised lactate and a metabolic acidosis with a base excess of -10. Your recommendation is that the patient is reviewed urgently by the vascular surgeons for a potential open AAA repair. When you refer to intensive care units, you need to be clear of the reason you're referring. Is there an escalation of care? Does the patient have a DNAR in place? Have there been any discussions? It's important to note functional status when referring to ITU and any comorbidities. You need to have any results of investigation at hand, and often ITU will ask for an ABG or a VBG with the latest results. Has this patient had any previous ITU stays? And how many and how long in the past? Are there any reversible causes? And if not, is ITU appropriate? And what's the urgency of the referral? Do you need ITU to review this patient now? Is this a preemptive ITU referral for a patient who may be about to undergo major surgery? This is an example ITU case of how to refer brittle asthma to the ITU department using the SBAR mnemonic. You have a 16-year-old female patient who's been admitted to MAU with worsening shortness of breath and is now unable to complete sentences. Her chest has become silent on auscultation and the patient has become increasingly drowsy. Using an SBAR mnemonic for referral to ITU, you would say that a 16-year-old female patient with known brittle asthma has come in with worsening shortness of breath. Their chest has become silent on auscultation and they've become drowsy. They have known backgrounds of fragile asthma and they have been unresponsive to treatment in the emergency department, including repeated regular nebulizers of salbutamol, ipratropium, IV hydrocortisone and IV magnesium. You've done an ABG under assessment, which you should tell ITU, which shows a PaO2 of 6.7, a low pH and a raised PCO2 suggesting a type 2 respiratory failure. Your recommendation is that ITU come to see this patient urgently for possible intubation and ventilation. In summary, it's important to know the team that you're speaking to. Have you got the correct team and are you providing the correct information? Be clear, concise and prepare where possible. If you don't know the answer, say you don't know. Don't make up any answers and don't try to fill in any blanks. Explain the outcome that you want. Do you want advice? Would you like the patient to be reviewed or would you like the patient's care to be taken over? Take your time when making a referral. It can often be difficult and complex, and many patients have difficult past medical histories that require time to be reviewed. And always know how urgent the referral is. Would you like this patient to be seen right now? Are they acutely unwell? Thank you.